Hi, I am Divya Kamerkar. I am the CEO and co-founder of Pinky Promise. Now, before I go into how Pinky Promise is automating reproductive healthcare for women so you can have healthcare on your fingertips, let me tell you about the problem that surrounds reproductive healthcare today, starting with India. So in India alone, there are 316 million women of menstruating age. Of these, 80% actually don't have access to a gynecologist because there's only one gynecologist for 5,100 women of menstruating age. In addition to the physical barrier in terms of access to a gynecologist, there are a lot of social barriers preventing women from accessing quality reproductive health care. When we interviewed nearly 200 women between the ages of 18 to 35 living in big and small cities of India, we found that even those with access to a gynecologist, 70% of them actually chose not to see one when they had a reproductive health issue. And this is because in our culture, it's actually considered to be very taboo to openly talk about these kind of subjects, even within your family, so leave alone to a provider. As a consequence, they just don't go. So the question then is, what are they doing instead, right? Thanks to the cheapest 4G internet rates in the world and a large penetration of cheap smartphones in the Indian market, women just Google their symptoms. Here on the left-hand side is a word cloud that actually shows the reproductive healthcare keywords that are Googled frequently. And as you can see, there are more than 100 million searches per month in India in English alone for reproductive healthcare keywords. But at the same time, when we asked people, okay, are you able to find the solution for your answers just by searching for it? We realized that most of them are unable to. But this provides an excellent entry point. The fact that people are searching for their symptoms online provides an excellent entry point for an app that ultimately ends up providing a precise and personalized diagnosis, and it's reliable and instant. So that's why we actually built Pinky Promise. We provide instant reproductive healthcare on a mobile phone. The way that we do it is we have automated diagnoses, prescriptions, and fulfillment. And we also have issue-specific chat rooms that satisfy the psychological need for a doctor. On the left-hand side, throughout these slides that you're going to see right now are actually screenshots of our app as it is today. So the first part is a diagnostic chatbot that was built out by a gynecologist within the organization. It covers all commonly occurring reproductive healthcare conditions, and it's actually built using the protocols of best-in-class medical institutions for different disease areas. This means that we're 100% confident at the end of the day when we use our logic-free driven system to tell people that because of this particular symptoms and these series of symptoms and other underlying information, this is probably what you have. It's also private and it's instant. This is actually a screenshot of a question to screen for urinary discomfort right here. The second thing is automated prescriptions. So as a layer that is on top of this free diagnostic chatbot are automated prescriptions with a payment of a nominal amount of rupees 50, which is around $0.7. We will start with a symptom assessment and we'll ask questions to understand different symptoms. Follow that up with an assessment of medical history and risk factors. After which, if everything is clear, the user pays a small amount of money. And instantly, the prescription is generated on the back end because we have doctors on the back end looking at a dashboard where all of this is auto-populated and sent out. And if lab tests and other diagnostic tests need to be booked, we actually have received a strategic investment from the proprietors of one of the largest international path lab chains. So a person will actually be at the user's doorstep within a few hours. And within 24 hours after that, the user receives a report for that particular test. And we're able to follow up with a confirmatory diagnosis and fulfillment. This is actually this end-to-end system that we're building is trying to automate several elements of the diagnostic process, which has applications far-reaching, not just restricted to women's health. We also finally have this community building element in our chat rooms. Users, anonymous to other users, can come to any of our 4 issue-specific chat rooms on the app today and ask whatever follow-up questions they have on their mind. So on the left-hand side, as you can see, A, T, P, A, we don't know who these people are, but they're clearly asking questions which they would otherwise not have been able to ask if their identities were not anonymous. And these are kind of follow-ups to what they've already figured out on our chatbot. We have spread so far with 0 marketing dollars spent, all through user-driven referrals in 8 months since our app has been live, starting with 70 users in a beta that were randomly selected from a sign-up list. We have now spread to 8,000 users all over India that you can see on the map on the left-hand side. Now, 60% of these users are actually from smaller towns and cities, not from the big cities of India. And 53% have never been to a gynecologist. So we are the primary source of reproductive healthcare and information to them. Average engagement time per user per session is 15 minutes, and it's only been increasing since the app's launch. Our MAU and WA is also really high right now, and it's been growing at 192% in terms of user growth rate every 4-week period since the past 3 months. So we're actually targeting a pretty large market. It's 370 million in the next 5 years and 3.6 billion in India alone. And that pie is only expanding because of improved health-seeking behavior and increased expenditure on healthcare for women. And of course, our primary revenue stream is what I just described to you previously, which is chargeable automated prescriptions and care. So we'll do everything end to end, all the way from telling a user what issue they have to fulfilling whatever prescriptions they have for that issue to a lab test. And so on. And our price is actually going to be highly competitive because today in India, even the cheapest telemedicine platforms charge around $3.50, and we'll be charging literally 60 cents. We also believe that we can play a very significant role to the larger healthcare industry. And finally, with respect to our team, we have totally 18 years of healthcare experience and 12 years of tech experience with me. I've studied healthcare and biology, as well as I hold an MBA. And Dr. Reema Shah has been a gynecologist for the past 8 years. She's leading our clinical practice. Rahul and Tanmoy have been leading the technology side of things, with Tanmoy actually managing a team of developers and achieving all our goals on a day-to-day basis. And Rahul does a lot of the technology architecture. Our GTM is also quite clear. We'll be reaching 1 million users by the end of this year, especially thanks to the strategic investment that we've received and to all the support from Seedstars. We're quite confident of being able to reach this goal, and we have quite detailed plans to get there. With that, I'll end this presentation. Thank you so much for listening to me. Thank you.